Hi. Knee pain Knee pain is described as a form of pain, tenderness, or discomfort in your knee joints, right? Of course. Knee pain is also common. It's a common symptom in people of all ages. It doesn't matter how old you are, you get knee pain, right? It may start suddenly or often or after a injury or exercise. Knee pain is also may begin as a mild and discomfort, and then it slowly gets worse. Hi, welcome to Stress Out Stress Free. If you haven't met yet, my name is Vincent Woon, where I help people like you stay stress free by changing one habit at a time. Okay, today we are going to talk about, what are we going to talk about? We're going to talk about getting to know your knees. Why is it so important to get to know your knees, right? Okay, let me just let's go to one second here. So let's look at why is it so important to know your knees, right? Today we're going to be talking about knee pain. So with knee pain, why is it so important, right? So first of all, we just look at the structure of the knee, then we go from there. Okay, all right. Let's look at the structure of knee. What makes up of the knee, right? One second here. Let me just. Okay, all right. So basically, we have three bones, and let me see. Here we have. Oops. Here we have. Oops. Okay. Here we have. Why is it not? Okay. All right. Okay. Here we have. Something is not working today. All right. Okay, we have three bones. This is first we have the femur bone or the thigh bone. All right, and then we have the oops. Okay, this is the femur, and then we have the tibia, which is the shin bone, or it's called tibia. And also we have a, let's see, okay, let's stick with the bone. Okay, the bones, this is, oops. This is, okay, this is the, why is it? Okay, so this is the patella, so kind of like a shield kind of looking, yeah. Okay, so this is the patella. So we have all three bones there, right? So next thing we want to do is we want to figure out what else do they have. They have a something called, they have two types of ligaments. One is called collateral, or one second here, let me just pick up a color. Let's say, okay, let's pick this color. Okay, collateral is usually one. Why is this popping up? Okay, collateral is one. This is one of the collateral ligament here. Okay, we call this, or they called it lateral collateral ligament. Okay, and that's another one here. So that's lateral. This will be posterior, right? Posterior collateral ligament. Okay, All right. So we have the ligament. Then they also have a cruciate ligament. Let's change another color. Cruciate ligament. Let's put this maybe red. Okay. All right. Cruciate ligament is I forgot to explain. Okay. So with the lateral ligament, what they do is they help hold the excuse me, they help hold the each side, help hold the knee that goes inside and outside of the knee, so it helps control sideways movement of your knees. Okay. And the cruciate ligament, which we're going to show now, which is like a cross here like this. Okay. And we have let's see, this is the medial cruciate ligament, and let's say the front is anterior, no, medial, yeah, anterior. Top, sorry. Medial, anterior. Yeah, that's right. Okay. Anterior cruciate ligament. All right. So you have those two ligaments. What does this cruciate ligament does? Now it's inside the knee and it's like a cross, and what happens is help you to move forward and backwards. So yeah. So it's the cruciate ligaments help you to move forward and backwards, and then the collateral ligament helps you to walk sideways. Okay. All right. Then let's see what else do they have on the leg. Oops. Oh, 1 second here. Okay, we have cartilage. Cartilage, articular cartilage. So what do they do, right? One covers the end of the shin bone. I mean the femur. 1 second, change the color. Let's take light blue. Okay. All right. So what this is the cartilage, like down here. It's called the articulate cartilage, and one is up there on the femur bone, right? And then one is down here on the tibia bone. So what it does is it's a slippery substance. So when you it helps the knee bones to glide and glide smoothly across each other, and at other times it helps you bend and straighten your leg. So it's pretty important, right? This articular cartilage, right? Okay. Next but not least is the meniscus. Meniscus is a something like a wedge kind of like a C looking kind of a tissue wedge piece of, it's like a soap absorber picture, like a cushiony kind. It's like a soap absorber between your shin bone, which is the tibia, and the femur bone, which is the thigh bone. All right. So the inner side of the, it helps inner side of the knees, and the lateral side helps the outside of the knee, right? So both of them help cushion and stabilize the joints, so that that's why when they are tough and rubbery, so it's like it can bouncy kind of. Then when you torn the cartilage in the knee, that is usually where the meniscus is torn. Okay. All right. Let's see. Let me just take this away. Ta-da! Okay, all right. So let's go to the next one, which is, let's find out what the causes are. The causes can be injuries or basically overusing injuries caused by overusing, right? And also causes that without injury. So we're going to find out what are the causes that with injury first. Okay, let's go to the injuries. Injury, and why you're not moving? Okay, all right. So injuries, first we start with bursitis. Bursitis is inflammation from a repeated pressure on the knee, such as kneeling for a long time or overusing your knee for a long time, or injury. Okay, so that comes from inflammation from bending down or kneeling down. Okay, all right, putting too much pressure on it. And then the next injury would be dislocation of the kneecap. So maybe you're playing sports and you just push it, or you twisted it, and then the kneecaps kind of like pop out. All right. These are also injuries, causes by injuries. Fracture of the kneecap. Things happen, right? So somebody hit you, or you fell, or you break your kneecap, right? And then also we have the iliotibial syndrome. Iliotibial syndrome is iliotibial is a thick. Let me show you. There's a thick side. Let me see. There's a thick side ligament that runs from all the way on the side of the thigh to the head to the tibia. All right, to the head of tibia. So it runs on the side here. So what happened is iliotibial syndrome, right? 1 second here. Let me just take that away. So iliotibial syndrome, pain in the front of your knees, right? So, and so a lot of people, nope, that's not enough. This pain of the outside of the knee, sorry. Iliotibial is pain on the outside of the knees, and sometimes you need to work on it because most people who heard that is like athletes and stuff. Okay, all right. Patellofemoral syndrome. Patella. So basically, it's patellofemoral syndrome. Is a pain in the front of the knee. So this is what I was talking about. So it's pain in the front of the knee around the kneecap. So let's see. Okay, best break the thing out. And basically, remember this was the kneecap here. So it's pain around here, around the knees. So, okay, so you get the idea. That's the patellofemoral syndrome. Okay, let's take that away. All right, let's look at the next one. Torn ligaments. Of course, torn ligaments are the anterior cruciate ligaments, which is let me go back here. All right, which is this red one here. Let me bring my pointer finger up. Pointer, where are you? 1 second here. Pointer finger. Open. Oops. Take that out. Okay, so torn ligament, right? We're talking about. So this is the anterior, remember the cross here we had. So that's the anterior ligament, or the medial ligament. So the medial cruciate ligament. So that's injury on that area, and then it may cause bleeding into the knees and swelling too. Okay, so next we have the torn cartilage. Torn cartilage is usually the meniscus tear, which is the purple one. That's the one that holds, the one's like a cushion. It's a C, wedge shape, like a C. So that's the one that torn cartilage are usually torn meniscus, and the pain on the inside or the outside of the knee joint. Okay, all right. So let's see what else. What's next? That's next. Oh, sorry, I forgot. Okay, we have strain and sprain. Strain and sprain. So, what is strain and what is sprain, right? Basically, strain and sprain, I'm going to say, it's minor injuries to the ligament caused by a sudden unnatural twist. Okay, so strain involves an injury on the muscle itself. And then, so basically, there's muscle that along here and also here. So basically, what it is strain involves an injury of the muscle to the band of the tissue. So basically, it's the muscle itself. It's not the bone. Okay. And then, what a sprain is? Sprain injuries is the tissue that connects the bone here, like this. Remember, this is the femur bone, and this is the tibia bone, and it is like where it connects, where the tissue connects is called a sprain. Okay, all right. Let's go back a second here. All right. So let's look at just turn that off. Injuries without causes that which cause without injury. First, we look at the injuries, right? Causes of knee pain that caused by injury. Now we look at the causes of knee pain which without injuries. Okay, let's see what we have here. So arthritis is to the knees is a common type of arthritis. Although there are many types of arthritis, so we can look at osteoarthritis and rheumatoid arthritis. So osteoarthritis is a disease gradually caused by the cushioning of the cushioning cartilage, which within your knees, to the wear and tear, resulting in pain when the bone rubs together. So basically, what is in the middle of it, like the we said earlier, the meniscus. All right, basically the meniscus is gone, so you bone rubbing bone. So that's what it's called, osteoarthritis, and it's most common in people over age of 50. It's unknown for anybody who's younger. So osteo is basically bone rubbing bone, and usually happens to older people, and basically wear and tear. All right, could also happens to people like athletes and stuff. Okay, all right. Let's look at rheumatoid arthritis. Okay, rheumatoid arthritis is a little different. It usually affects younger people, and is an autoimmune disease. Okay, 1 second here. Let me just get a sip of drink. I'm drinking okra water. One of my friends told me that if you soak the okra in the water and for 7 hours, and then if you drink it, it will help with blood pressure and also diabetic too. So I'm just trying that out this week. All right, I'll let you know the result. Okay. All right, so let's go to rheumatoid arthritis. Yeah, right. Younger people are immune to this. Is an autoimmune disease, which means one immune system attacks a certain tissue in the body, and in this case, it attacks the membrane of the synovium that links the knee joint together, but may also destroy the cartilage too. So the cartilage and the bones and sometimes muscles and tendons. Okay. All right. So let's go to the next slide. Okay. Next slide. Where are you? Infections to the bone. Infections infection in the bones of the knee. So infection in the bones of the knee. So basically, you get infection to that affect the bones, right? Okay. And also into the knee joint. So basically, those are infections. And okay, bone cancers, cancer that spread to the bones or begin from the bones. Okay. And we also have oscus schletter. Oscus schletter. Oscus schletter is is a disease, of course, to be thought to be caused by small injuries that are from small injuries of overuse of the knees, before it's finished growing. So basically, like injuries when you're younger. So before you grow up, so it creates the oscus schletter disease. Okay, and the quadricep muscles, which is the quadricep is the thigh muscle. It's a large muscle, and strong muscles on the front part of the upper leg. When the muscle squeezes, contracts, it straightens the knee. So, and the quadricep muscle is important for running, jumping, and climbing. So basically injury on that, right? So when the quadricep muscle is used a lot, especially in sports or activities during a child growth, playing sports, this area becomes irritated and swollen and cause pain. And a common adolescents who play, kids go to soccer camp, basketball camp, volleyball camp, and also participate in gymnasium too. And it's this disease affects more boys than girls. Okay. All right. Okay. All right. Oscus schletter disease. That's what it is. Okay. Okay. Let's look at what are the symptoms. Swelling. Talk to the doctor if you have all these kinds of symptoms, right? So swelling, feel warm and redness in the knee. So swelling could be anything. It could be inflammation, and it's probably inflammation. Okay, all right. Why is it not clicking? Okay. Okay. So stiffness, a feeling of the knees is locked, and sometimes you will feel grinding and buckling of the knees. Like sometimes you stand up, it's like you can't move, and then you have to just kind of swing your leg off. Yeah. So, and also a feeling. I mean, what's next? 1 second here. Why is it? Okay. prickling, burning, and tingling sensation in your knees. Okay, and frequent muscle spasm around your knees. So your thigh bone, your leg bone, the thigh muscle and your tibial muscle, they all tightens up around the knee. So that's how you have a frequent muscle spasm. Okay, and pain in the calf, hip, shin, ankle, and also on your thigh. That's what we were trying to say earlier. So the frequent muscle pain, pain in the calf, hip, shin bone, it's the shin, ankle, and the thigh. Okay, and also weakness in or an inability to fully extend your leg. Okay, you can't really extend your leg. And also, last but not least, popping or cracking sound when you straighten or you bend your leg straight. How many of you had experienced that before, right? So yeah, so that's the causes, and let's go look at what are how to prevent it. Knee problems can be caused by many factors, such as injury, arthritis, disease, aging, and also overweight. Yeah. Although we cannot avoid the other knee problems, but we can lessen it by how can we lessen it, right? Let's see, how do we lessen it? Okay, so part of the prevention is to warm up when you before any sports by walking or stretching. Stretch. Always remember to warm up if you do a lot of sports. Okay, all right. It's important to get the blood flowing before you just start working out or start stretching it. Start pushing the knees or the muscle. Avoid sudden changes. It's all in the level. Sudden changes. When you do exertion in exercise and activities you currently enjoying. Just be careful when you don't just do of course, when if it's emergency, then it's a different story, right? So if something fall, just turn properly and bend your knees and go down and pick it up. Not just go bend down and then you're gonna end up hurting your wrist, your waist, your hip, and also causing pain in the knees, right? Okay, so shoes. Okay, shoes is very important. Try not to be cheap or try not to be stingy on shoes, because shoes are very important. What happens is, if you look at the bottom of shoes, right? If you look at the bottom of shoes, see how the sole is. If the one side of the sole is shaved off, maybe like this here, because this side is lower, so that means that your gait. See, let's say this is your body, right? Say this is your body. Let me straighten it. Okay, straighten it. So if it's lopsided, one side is lopsided, that means you'll be standing this way. And what happens is, you first start to mess up your ankle. Then, after messing up your ankle, then you're going to probably hurt your knee. So that's how it goes. Like, you hurt your knees, and then you go hurt your hip, your lower back, and then upper back, and then after back, your neck, and then it's going to hurt the head too. So that's all. That's why why it's important to have a good shoes. Make sure is balanced, and you're not lopsided either way. Okay, so that will create pain up from the knees up to the head. Okay, all right. Okay, so important to wear shoes and What else? Strengthening your leg muscle is very important to, through exercise such as walking and stairs. Walk up the stairs, working out with some weights. That will help. That will help strengthen your legs. Okay, and the second last one is, weight. Weight is always important because think about it. See, if you have too much weight, right? Oh, you only have two legs, right? How much weight can the legs hold, right? Think about it. Yeah, and how much weight can the ankle hold, and how much weight can your knee hold? Excuse me. So, see, weight is important because if you think about it, you put like 200 pounds on let's say let's estimate like the leg is about, let's say it can take like 50 pounds or 100 pounds, right? So for the long run, it's definitely going to cave in because the heavier you are, the more stress you put on your knees and of course your ankle and your knees too, right? So make sure you have proper diet and make sure you control your weight and eat right. It's good to eat right, be healthy, right? And exercise all the time. Okay. All right. Last but not least, we have stop smoking. Stop smoking. Why? I mean, smoking seems to be like the thing that for a lot of stuff, like, everything you say, in order to get rid of diabetes, stop smoking. In order to get rid of high blood pressure, stop smoking. So a lot of stuff that involve is caused by smoking. Why is it? Current smokers increases the risk of the cartilage loss and also the medial compartment of the femoral, tibia femoral. Femoral is the tibia is the big bone underneath your knee, right? And the femoral is the tiny bone under your knees. So yes, no, femoral. Oops, sorry. Tibia is the big. Tibia is the small bone. The bone underneath, and the femoral is the top bone. Sorry, wrong answer. So what happens is, it increases the risk of the cartilage, loss of the cartilage. So it'll affect the joint, and then in most men men who are not current smokers. Okay, so basically, they're comparing that's like smokers usually in men's that is like more smoking man has problem with this. So of course, I think because we are probably more active and do more heavyweight stuff, so that's why it causes that. And smoking causes the risk for cartilage loss. Okay, all right. So yes, that's pretty much all we have here. Thank you very much, and let's see if you have any questions in the chat. If you have any questions, please put in the chat so we know. Even though you're watching after this live, if you have any questions, just put in there. If not, let's go through. All right. So basically, I want to thank you very much for watching. If you can support the channel, we'll be happy to. And you can always go to buymeacoffee.com/Vincent Woon, or you can always go to our merchandise store to check out our what happened to my camera? Okay, to check out the merchandise there. Okay, And also, don't forget to stay stress-free by changing one habit at a time. And I see you in the next video. Thank you for joining us. You can always contact me at Stress Out Stress Free, and also Stress Out Stress Free in Facebook, Instagram, and Vincent Woon in Twitter, and also in LinkedIn. So best way is messenger me in Stress Out Stress Free, and I will be happy to answer any questions. So I see you in the next video. Also, don't forget to check out these videos that's gonna pop out later.